My name's Emma Lawrance. I'm the Climate Cares Lead at the Institute of Global Health Innovation at Imperial College London and affiliated with the Grantham Institute for Climate Change and the Environment. So the Climate Cares program, which is launching as a centre in just a week, is what we believe is the world first centre to fully focus on mental health and well-being in the climate emergency. We've been running for about 4 years now as a program of researchers across different backgrounds, designers, policy experts, and educators, trying to create a safer climate for mental health and well-being, because we know that the challenges affecting our planet are also affecting our minds, communities, and healthcare systems. And this has really come from my own experiences of working in mental health, working with young people, also my own experiences of mental illness that were then affected by my awareness of the climate crisis and seeing the impacts on my homeland in Australia, and my PhD studies, which were on understanding how the brain responds to uncertainty, how we make decisions under uncertainty, and how that interacts with anxiety. And so I was really struck that in youth mental health and digital mental health support, where I was working 5 years ago, there wasn't discussions around, well, what is happening to the way we're thinking and feeling when, particularly for young people, they're inheriting this increasing uncertainty, this increasing challenge, and really wrestling with this myself. But of course, once I started to look into this, I recognize and just keep learning more and more and more how deeply climate change and mental health are interlinked. And I know many of you might already be experts in this, so I hope you still pick up something new, and it can set the scene for a wonderful day of discussions for those coming into this space. And what we're seeing more and more is that there is sadly a vicious cycle where climate change is a mental health emergency, and it's directly and indirectly impacting mental health outcomes and multiplying risk. And this in turn, when people are experiencing these impacts, can limit their capacity as individuals, communities, or systems to actually cope with and act on climate change. And I just got back from Nairobi, from Africa Climate Week, and heard from an amazing clinical psychologist practicing in Nairobi, who was a farmer whose own mental health was deeply affected when she lost her farm as a result of the changing climate and the impacts of that on farming. And she, being an amazing human being, was like, I need to understand what's happening to myself, but also support others. I went back to school, went back to training, and has now set up a program to support others. But the farmers in the communities she worked with, she's saying, well, it's great we're talking about climate adaptation. It's great that we're talking about drought-resistant crops, but what if these farmers, they can't get out of bed in the morning, some of them, because they're depressed? Farmers are dying by suicide. They can't then actually enact what we're even talking about. So that's this vicious cycle. And so just to step back and elaborate a little bit more about the many pathways by which climate change is accelerating and compounding risks for mental health, we know, and we're witnessing around the world, that there's rising temperatures as a result of burning fossil fuels. This is leading to ice melting, to sea level rise, to more acute extreme weather events, more chronic extreme climate events. And what they do, and we know this, but we don't always join the dots. What those impacts do is that they damage homes and properties. It leads to crop and livestock damage. It leads to people losing their homes and being forced to migrate. It leads to them experiencing directly high temperatures, which in and of itself, we know has a range of mental health impacts, including, sadly, more deaths by suicide, more people showing up to emergency rooms, and worsened sentiment across the population. We see loss of habitats, communities breaking down, changes to livelihoods, disruptions to health systems. My Uber driver in Kenya was saying that it's incredibly stressful. He's like, if my wife called me right now and my daughter was sick, I would be panicking because my money is now going almost entirely into food, because food prices are going up, because crops are failing because of climate change, and I don't have money for healthcare. This is what he was naming and making these links. We're also seeing that it's not only all of these events happening right now, but it's knowing that they're coming into the future and witnessing changes to homelands, to cultures, and being disconnected from the world that we once knew and the natural spaces that hold such importance to so many people. And understandably, these events and experiencing them, witnessing them, being aware of this into the future is sadly leading to more cases of suicidal thoughts and deaths of despair, more symptoms and new cases of diagnosable mental illnesses. This can show up in things like substance abuse, post-traumatic stress disorder, anxiety, depression. We see more susceptibility to physical ill health or death for those with diagnosable mental illness. And again, this is something where there might be a lack of awareness of how vulnerable people are with pre-existing mental health conditions to things like heat, where in fact they're up to 3 times more likely to die from a heat wave than those without. And we also see that holding all of this and experiencing all of this can worsen population mental health and well-being and generate distress. But these challenges, the climate crisis, mental health, do not exist in isolation from each other or from the rest of a system of interconnected challenges. And we need to zoom out and see these things as connected so we can act on them as connected and see both the compounding risks, but also the opportunities for win-win actions. What we see is things like burning fossil fuels worsens air quality. People who are exposed to poor air quality are more likely to die from COVID-19. They're more likely to experience depression, anxiety, higher suicide risk, and even a higher risk of developing schizophrenia. They're more likely to have physical health problems, and they're more likely to be from low-income groups. There's huge inequalities here across racial divides and also across socioeconomic divides. And burning fossil fuels is the cause of the climate crisis. So all of these things are linked, and this is just one example. So if you're listening to this, what it can feel like is maybe a bit like this figure on the right. And many people, especially the communities who have contributed the least and are suffering the most, can feel like they're screaming into a void, and that scream is just growing and escalating. And understandably, this leads to a range of really difficult and sometimes very uncomfortable emotions that are very understandable responses to the threats faced. And many of you might be feeling like this, even listening to me talk about this. So people are experiencing things that are being labeled climate anxiety or eco-anxiety. These are terms for very multifaceted experiences that we're just beginning to understand. That can be related to fear and worry, existential anxiety, but also can be related to a whole range of strong emotional responses, including overwhelm, anger, despair, guilt, and fear. But also we can feel sometimes numb or denying or disavow of what's happening. People are also feeling homesick while being at home due to negative environmental change. And these experiences are shaped by personalities, by how close we feel connected to nature, by pro-social values, by social and cultural dynamics, but importantly also by direct experiences of the climate and ecological crises. These are not just global north phenomenon, not just white phenomenon, not just rich phenomenon. The people who are self-reporting or are experiencing direct impacts of the climate crisis are much more likely to have high levels of distress. But this distress isn't driven so much by the climate crisis as by knowing that there is insufficient action from people in power, and there's a betrayal across generations, across countries, and within countries of the people in power to the people they're serving. And from our data, we saw that young people in the UK, even in the midst of a global pandemic, were more likely to be distressed around climate change than COVID. And while the majority were moderately distressed, the top 10% were highly distressed, and they worried more about climate change for their own future, and this is in the UK, than they did about anything else we listed, than jobs, pandemic, study, politics, relationships, etc. This is changing the way that people are making decisions about their future. Young people in the US, if they had experienced a climate event, 1/3 of them were scared to have children because of climate change, compared to 1/5 of people who hadn't experienced or self-reported experiencing an event. We're seeing this showing up with mental health professionals reporting increasing prevalence of problems linked to the climate crisis. However, as I said, this is an issue we're only trying to unpack and understand as researchers over the last years. And these are nuanced, complex feelings that many of us know we experience in multifaceted ways. And it's important to note that we don't want to rid people of this distress or pathologize it. It's an understandable response to the threat, and it's been linked to more action taking, and there are well-being benefits of taking action, and particularly taking action collectively. But again, it's multifaceted and complex, where there's also a risk of burnout if that action is not supported and sustained appropriately. Why does it matter for climate action? So one mistake we could say that the climate movement has faced historically is giving the facts and believing that would be enough to catalyze action. That we give the data, we give the evidence, and that will drive change. And as a scientist, I strongly believe in evidence. However, we know that human beings make decisions on the basis of feelings. We change our mind on the basis of feelings. Understanding how we're responding emotionally and psychologically to the climate crisis and how that interacts with the narratives we hold and are told is vital to enable action. Our state of mind impacts the state of our world, and the state of our world impacts the state of our mind. And we urgently need to pass social tipping points before we keep cascading through geophysical tipping points. So what we see is that many of these feelings can be barriers to action if we are holding so much anxiety or grief that we become paralyzed, or we're feeling numb, we're in denial, we're in disavow. But it's important to understand these are just defense mechanisms trying to keep us safe in an unsafe climate. And on the flip side, there are a range of emotions, including hope, including agency, but also more uncomfortable emotions like anger, like rage, which can be really linked to an understanding of the injustice that is occurring, and the injustice that is occurring with the massive profits of fossil fuel industries and the impacts that I've been seeing on people on the ground in Kenya, for instance, who have contributed nothing to this problem. But taking action in itself, as I said, can be a catalyst to a virtuous cycle. So how do we transform from this vicious cycle I described into a virtuous cycle? We need to strengthen agency and strengthen hope. We need to strengthen social connections. The IPCC says that resilience isn't just bouncing back, but the capacity for transformation. So we need to strengthen hopefulness and agency. But when we talk about hope here, we're talking about not just passive hope of waiting for things to change, but hope as a verb, hope as something that is working towards a future that we want to see, using the human capacity for imagination. It is possible to hold distress and high well-being together, but that means holding hope, holding meaningfulness, making meaning in the context of the world we're living in. And it can also mean some people holding that anger, but holding it in ways that catalyzes change and creates this virtuous cycle. And that behavior in itself can be related to higher well-being and meaning in life. So not only on an individual level, but on a systems level, on a community level, we need to start to flip this vicious cycle into a virtuous cycle for climate action. And for that, we need a vision for the world that is worth fighting for. Not only holding space for what we're grieving, what we're losing, and seeing the possibilities for things to get worse, but also always knowing we can be pushing to the path towards the future that we want to see, towards the future that is better, towards the carrot as well as the stick. So how can we see these win-wins for action and create this virtuous cycle where we can generate individual and system change that then feeds back on itself to improve our mental health? And climate action is mental health action. We need it urgently to protect mental health from all the cascading negative influences I outlined. But also, the actions we need for a safer climate are fundamentally aligned with what we need to strengthen the social and environmental determinants for good mental health and well-being. There is a win-win here. When we unpack what is causing the climate crisis, obviously it's burning fossil fuels, but it's perpetuated by some of the structures in our societies. These can include a disconnection between ourselves and others, and us and nature, an overconsumption, a hyper-individualism, colonialism, extractivism, unequal societies, a lack of participatory governance and trust, and unhealthy air, water, and food systems. But if we recognize these, we can work towards flipping them. And the IPCC reports clearly outline these links between well-being and lower emissions. Societies and countries with more participatory governance and trust and lower rates of inequality have lower emissions and better well-being. We can work towards more mindful consumption and pro-social values, strengthening communities, strengthening the connection between ourselves and others, and us and nature. This is what we need to be able to cope with and act on the climate crisis. And of course, if we have healthy air, water, and food systems, we will all benefit. And so this can look like things like improving the energy efficiency of housing. For instance, this makes homes more affordable to heat. People don't have to choose between eating and heating. That has big mental health consequences, but the cold homes themselves can be very problematic for mental health. And obviously, this reduces emissions too. Similarly, we see win-wins with cycling and walking facilities, green and blue space, and connected communities. And there are many, many examples of this. So thank you so much for listening to me today. There's always so much more to discuss, and I'm sure you'll hear so many amazing examples from all of your colleagues across today. It's a pleasure to introduce some of the ideas and ways that climate change and mental health are deeply linked. If you'd like to find out more, please visit Climate Care's website, or Connecting Climate Minds, our global Wellcome-funded project to build these communities of practice in all 7 SDG regions, build a vision for climate and mental health into the future that meets these emerging needs, and engages with youth, Indigenous communities, smallholder farmers around the world as well. So yeah, it's been really an honor and a pleasure, and thank you so much for having me.